Good morning, ladies. It's Laurie, and we are here with another guest expert today. I'm so excited to welcome Beth O'Hara, who is a functional naturopath with an expertise in mast cell activation and mast cell syndrome. And a lot of people have never heard of this or don't know what it is. So welcome, Beth, and we're looking forward to hearing about your area of expertise.
Oh, thank you so much. I'm really excited to be here because this is often a big eye-opening conversation for people and a big game changer, particularly in the area of cancer.
Mm-hmm. So in what way? First of all, why don't we define what your area of expertise is, and how is it confused with other illnesses? I understand in my practice, it's a very difficult illness to diagnose, say, oh yes, you're sick this way because you have this problem. So let's talk about that.
We probably need to start with what are mast cells.
Perfect.
So these are some of the frontline defending cells of the immune system. I think of them as the guards of the castle gate, and the castles are bodies. The mast cells are part of the interface between our bodies and the outside world and everything that's happening internally in our bodies. So they're in almost every tissue. One of the only exceptions is the retina, the back of the eye. So that means they're going to be in the skin, they're going to be in the mouth tissues, the esophagus, all the way down the GI tract. They're in the stomach, they're in the lungs, they line the blood vessels, they are in the muscles, they're made in the bone marrow and they migrate out, and they're in the bones, they're in the brain. And this is really critical for this conversation we're going to have. There are mast cells at every nerve ending. And there's an interface between the mast cells are the interface between the nervous system and the rest of the body. So that comes into how stress triggers health conditions. Now, everybody wants to know, well, what are the symptoms? How do you know if you have it? And that's what's made this so challenging, because it really depends. There's lots of presentations. It depends on which mast cells and which tissues are being affected, first of all. So if we have mast cells in the skin being affected, people might get things like rashes, or they might get redness or flushing easily. They may get, when they scratch themselves, they stay red for a long time, or they could have white lines for a long time. Things like eczema, psoriasis, hives, we can see any of those things showing up if there's skin involvement. Now, there's not always skin involvement. That's an area of misunderstanding that's out there. There's a lot of people who think that you have to have rashes or hives to have mast cell activation syndrome. You don't.
Oh.
And then if you have issues with the mast cells in the GI tract, you can have all kinds of things, again, depending on what's going on. Some people get throat closing. Some people will get heartburn or acid reflux. Some people get diarrhea. Some people get constipation, abdominal pain, issues, discomfort when we're eating, inflammation in the GI tract. Then if we've got involvement in the lungs, we might have tightness in the lungs. We might have phlegmy kind of stuff coming up, asthma, those types of inflammatory involvement in the lungs if we've got the lungs involved. When the nervous system is involved, we're going to see things like anxiety, depression. We can see rapid mood swings. We can see, we think about the nervous system controlling the heart rhythm. So we get heart palpitations and anything that's related. People can have weird nerve pains, nerve signaling types of issues. So you start to get this picture. If we've got involvement in the sinus tissues, we can have sinus congestion that's chronic, postnasal drip. People will do the throat clearing if they have that. So this kind of, when my husband met me, I have mast cell activation syndrome. He always thought I was trying to get his attention. He's like, no, I'm just clearing my throat. And then if it's around, these tissues around the eyes, we can have itchy eyes, red eyes, things like that. We could go on. I mean, we can go the reproductive organs. We've got connections with endometriosis, connections with menstrual issues. We can go to areas like the bladder and the urethra. We can have connections with interstitial cystitis, that kind of pain and burning with urination. People can have muscle pain, they can have bone pain. So of course, that's not clear cut like somebody who might just have type 2 diabetes.
No, it's
And
not at all.
right,
That's one of the difficulties in diagnosing this, I think, right?
exactly. And so to add to the picture, mast cells have over 200 receptors on the outside. So that means they're sensing what they can sense. That's a lot on a cell. And they have over 1,000 different chemicals they can release, and those are called mediators. So histamine is the best well known. Histamine is made in mast cells. There's only 2 other cells we know of that make histamine, but mast cells make a lot. What's become a really household word is cytokines. Mast cells make a lot of cytokines, and those are chemical signalers between these different immune cells. So I'm going to connect this over to cancer. Mast cells are communicating and calling these other immune cells, and I think of them like a conductor of the immune system. They're keeping the immune system orchestrated. They're keeping it responding the way it should be responding. When we have chronic triggers of the mast cells, and these triggers could be things like mold toxicity, which we also know is a huge cancer trigger, chemical exposures, chronic stressors, chronic traumas. There are connections with breast implant illness.
Yes.
These types of triggers, Lyme disease, and other tick-borne infections, these are some of the biggest triggers of these mast cells. They can't calm themselves back down. So mast cells are producing inflammation and ways to help us heal, repair, and to protect us. So that's their normal response. If you cut your finger, you don't get it cleaned out, bacteria gets in there, you start to get some redness and swelling, that's a mast cell response. You get a hip replacement, you're going to get some local inflammation for a while. That's the mast cell response helping with healing. That's all great. And they have dozens of roles. They're involved in pregnancy, they're involved in sleep-wake cycles, all kinds of roles in our bodies. But when they have a constant onslaught of triggers, which is the world we live in now,
Yeah.
we're exposed to more chemicals than we've ever been exposed in the whole history of human beings. And mast cell activation syndrome is really on the rise. So population studies are showing between 9 and 17% of the general population have mast cell activation syndrome. So I just want to put that on the table up front. This is why we need to be paying attention. That's a lot of people. That's 1 in 10, almost at least 1 in 10, 1 in 9, almost 1 in 8.
Very similar to breast cancer.
It's a lot.
Very similar. 1 in 7 or 8 women will be diagnosed with breast cancer in their lifetime. Very similar. And I think the underlying triggers, as you're talking about, are very much in common. They have go ahead. This is fascinating for
and
me.
I'm not saying all women with breast cancer have mast cell activation syndrome, but if cancer is there, we need to be looking at mast cells. And this is why. There is solid links in the research. I was talking with cancer, various types of cancer, and specifically breast cancer. I was talking about how the mast cells are these orchestrators for the immune system. And so for people there are different branches of the immune system. Think about how to put this simply. So we have our pathogen killing side, or virus or bacteria killing side. And when that side of the immune system isn't taking care of a chronic infection, let's say Lyme, or let's say Epstein-Barr, whatever it is, then you'll get chronic inflammation that tries to take over to protect us. And we know there's this chronic inflammation link with types of cancers. Mast cells are involved in both those sides of the immune system. But when you get this chronic inflammatory side that stays elevated, that opens us up to higher risk for autoimmunity. And almost every type of autoimmunity has been linked to mast cell activation syndrome and aberrant mast cells. And it opens us up to greater cancer risks. because we know cancer is part of an immune system disorder. So I hope I'm putting those pieces together in a way that makes sense.
You are. Yes, you are. Absolutely. Go ahead.
Well, that's where we can describe this simply, and to really encapsulate what is mast cell activation syndrome. It's a multi-system, meaning two or more systems in the body, inflammatory condition that comes with flaring, means it waxes and wanes. The symptoms aren't solid state. Now, people may have intense symptoms. People may have really mild symptoms. Some people who are really affected by this can have constant anaphylaxis, which is where you get throat closing, you can't breathe.
Dangerous. Oh my goodness, you're so sick.
But there are a lot of people without anaphylaxis with mast cell activation syndrome. So let me give you a couple case examples so this can really make sense for people. I'm thinking of just a few of the cases I've worked with. And I put people in three categories. I have clients who come through who are my easy clients. They can take whatever supplements they need. They're not having trouble with food sensitivities. They might have a really mild case. And I think of a man I was working with, CEO, lots of stress, too much stress, had mold exposure, and he was getting things like chronic fatigue, brain fog. He didn't have skin symptoms. He had some GI issues with heartburn. So that's what was showing up for him. So that's kind of an easy case. Then I have what I call my sensitive complex people.
Excuse me for just a second. So, how did this person come to you? I'm sure they were already seen by somebody who specialized in SIBO or GI. I mean, how do they come to think, well, I have all this testing and they still haven't figured out. I think before we go into cases, we need to talk about that because that's a missing piece, I think.
Yeah, that's a great question. The diagnostic criteria for mast cell activation syndrome is still really in flux, and it's undergoing a lot of evolution. It's quite new. So this condition was only theorized in the 1980s.
Wow.
And it was not taken seriously until later 2000s. So 2007, you started getting the first case reports. 2016, we finally have a diagnostic code for that.
Wow.
It's still not taught in medical schools. I have clients who are medical school students, that they're medical school students today, and they're not being taught about this. And
oh my God, it's a second-year medical student. And I asked her, I told her I was doing an interview with you, and I said, she's expert in mast cell activation syndrome. Have you studied that? Because she already had her immune system section. And she went, no, Mom, what's that?
Right.
And I was very, disappointed.
That's concerning because this is one of the most under-recognized and unaddressed conditions that's facing the general population. It's just going to continue to rise. It's just going to continue to explode. But so that's part of the evolution of this. It's very new, and that's why this criteria is in flux, as opposed to type 2 diabetes. There's been diagnostic criteria established for decades.
Since the 50s, really.
Yeah. So what we have today, and this hopefully will keep evolving because it's problematic, but what we have today is there have to be symptoms, 2 or more systems. So that may be GI tract and the nervous system. It could be it could be chronic muscle pain, fatigue and weakness, and hives and food sensitivities. So, but it has to be more than one system. It can't just be seasonal allergies. That doesn't qualify. Then the criteria says that there has to be an elevation in one of the urine or the blood markers that test for these mediators. There's a few problems with that. One is that these mediators can be up and down within 15 to 20 minutes. That's a very short window to catch it. Then the sample, whether it's urine or blood, has to be kept chilled from the moment of collection all the way through processing. So if they're using a centrifuge, it has to be a cold centrifuge. Very few labs actually have that. The other problem is there are over 1,000 mediators, and we only have the ability to test for about a dozen. So this, you can see this is a really brand new stuff, and it needs a lot of expansion. The third part of the official criteria that's proposed right now is that there has to be an improvement in symptoms with a mast cell stabilizing medication or an antihistamine. So these are things like Claritin, Zyrtec, Allegra. Pepcid's actually a different class of antihistamine. Or mast cell stabilizers are going to be things like Singulair, Ketotifen, hydroxyzine is that's actually an antihistamine. Xolair, these are types of medications in those categories. The problem with that part of the criteria is that these medications, for the most part, have triggers in them in the inactive ingredients that trigger mast cells. They have dyes, they have titanium dioxide, they have talc, they have cornstarch. So how do you know? Unless everything's completely compounded in cellulose or baking soda or something like that, you don't know. And then there's so much nervous system dysregulation. Some of the people I work with who are super sensitive, they can't take any medication. They can't take any agent without reacting, no matter how clean or compounded. Hopefully this will continue to go through this debate and evolve. One of the other parts of that is there are two camps. One camp says that tryptase, which is one of the things that are being tested for, it's a blood test, is elevated mast cell activation syndrome, and that this is quite rare because it's hardly ever elevated. And then the other camp that's part of this debate says actually tryptase is not a good marker for mast cell activation syndrome, and it's quite common. The condition is quite common. So I'm in that camp that it's quite common, and tryptase is usually not elevated. But a lot of people are told they don't have mast cell activation syndrome. They don't have an elevation in one of these markers. And when I talk with my colleagues and when I'm observing, this testing's missing about 90% of people that have clear symptoms.
Okay, so it's really clear that one, you need a functional practitioner who has been trained in a functional approach to disease. And this is not by going to a standard allergy doctor, and I imagine that by the time someone has come to you, they've been through the GI doctor, the ENT doctor, had endoscopies and all different types of SIBO tests and everything, and they haven't changed their diet. They're still sick. So they come to you having been through a lot of different quote unquote experts through regular medical doctors. And then they come to you, and here we are. They have all their tests, but they're still sick. So how do you?
That's exactly right.
Yeah.
So people will either they may be referred by somebody who, a practitioner who recognizes that they're dealing with this. But more commonly, people are doing the research on their own because this is so new. And there are lots of groups online that are supporting each other. There are resources like our website, and people start looking up on their own and figuring out what to do and then reach out for help.
And what's your website? Just let me put it up here.
It's mastcell360.com, MAST as in Tom, CELL360.com. And what people might want to go to, there's a lot on that website. Best place to start, if you're curious and going, is this me? Do I maybe have this? So I took the research data on the symptoms that are definitively associated with mast cell activation syndrome and created a symptom survey. So people can go under MCAS and do the symptom survey and find out, should they look deeper into this? If you've only got 5 symptoms, probably not. If you're getting closer up to 50 points on that survey, then I would take a look at it or more.
Wow. Okay. Go ahead. I'm just writing notes here for everybody to read.
So if we go back to, I was talking about the kinds of levels of severity that we can have with this. So I talked about that easy case with the CEO and he'd had the chronic fatigue. He'd been an athlete, and then he crashed and was upset that he couldn't exercise hard. That's probably not most of our listeners here. So then we have what I call my sensitive complex. So these are people that are having a lot of symptoms. They're still functional in their lives, but they're not having a good time. They're struggling. The symptoms are challenging, and they have some sensitivities. They might have some sensitivities to certain medications, some supplements perhaps they're having trouble with. They might have trouble with things like glutathione or methyl B12.
Somebody have trouble with glutathione or methyl B12?
Well, those are going to be agents that can push detoxification. So a lot of the people I work with are so heavily loaded down with toxins, and you get these toxins stored in the tissues, and then you're pulling them out of the tissues. They're already swimming in a toxic soup in the bloodstream. There's no room for them.
They get too much die-off, and it makes them feel really sick.
Yeah, and too much toxin excretion, things like that. So they have to go much more slowly. They can't start with a whole capsule. They're going to start with a few sprinkles of something new. They're going to build up gently. And we're going to do things in a really clear order of operations, which starts with calming the nervous system, calming the mast cells before we ever go into detox. So I do all this preparation for them. That one example of a case like that is a woman that I have who she was having tightness in her chest, some trouble breathing. She didn't really have any skin symptoms, lots of GI issues, trouble eating, trouble sleeping, brain fog, couldn't fall asleep, couldn't stay asleep, heart palpitations. So that's an example of what kind of symptom presentation you might get in that category. Then there are people who are super sensitive. And these are people to come in and they may be able to take one or two things. They may not be able to tolerate chemotherapy. They may not be able to tolerate the medications that they would need for cancer treatment. They are having trouble with foods. They're usually on a limited number of foods that they can tolerate without having an increase in symptoms. And we have to go extremely slowly. So they might spend 6 months calming the nervous system before they could even start taking supplements or medications that would help calm their mast cells.
So how do you calm the nervous system if you can't take supplements or help somebody detox?
I think of this as our biggest tool in the toolkit for people who are really sensitive. So going back to where I talked about their mast cells at every nerve ending, and the mast cells and the nervous system have this constant communication loop happening. So the mast cells have receptors for neurotransmitters from the nervous system. And then the nervous system has receptors for mast cell mediators. Anyone that's dealt with cancer or chronic illness, that there is this whole piece of not feeling safe in our bodies when we have to deal with these things. There's a huge amount of stress with this. And I've been severely chronically ill myself. I was bedridden. I couldn't work. I couldn't read a book. I know firsthand what it's like to go through a lot of this. Many people in this community have had medical traumas. They've been told they're crazy.
Oh, I know. The first thing that happens is the woman goes to the doctor. They can't figure out, quote, what's the matter. And then the next thing you know, well, here comes out the prescription pad. Why don't we try a course of antidepressants? Drives me crazy.
Well, and here's the thing. It's like depression is biochemical. Sure, thoughts can feed into it, but every thought is biochemical. And there's a biochemistry of trauma. There's a biochemistry of stress. So we definitely need to move beyond all of that. But with the nervous system piece of it itself, the mast cells are overactive, again, to protect us because there's something not safe. That not safe could be a bacteria, could be toxins, it could be an injury. It could be that we're being chased by a bear, if we're thinking kind of evolutionarily. And our nervous system and mast cell axis is called the neuroimmune axis. Doesn't know the difference between I'm being chased by the bear, I have a toxic relationship. It's the same thing on that level. So just as we could think about if we had a bear in our home and we had to constantly be hypervigilant, and that's not going to be conducive for healing. If we're in a toxic relationship, if we're in a job where we can't take care of ourselves, if we are stressed to the gills with our health issues, whatever's going on, even driving on the interstate is stressful. You know, we didn't have that stress 100 years ago. We weren't driving on the interstate at 75 miles an hour.
75, why 95 where I live? Not me, but everybody else, yes.
Yeah. So we have to communicate to the mast cells that it's okay to start to stand down, that we're not being chased by a bear anymore. And we may have to set our lives up so that we're not being chased by those bears, proverbial bears, but the nervous system will get dysregulated in these conditions. And there's two aspects of it in particular. One is the vagal nerve system and the cranial nerves that come out from the base of the skull and the top of the neck here. That we call it the vagal nerve, but that's not a good name for it. It's actually a whole system. The vagal nerve is a huge nerve complex and it innervates everything from the top of the neck to the bottom, to our bottom. So the esophagus, swallowing, breathing, heartbeat, motility in the GI tract, whether it's too fast or too slow, all of that's controlled by vagal nerve signaling. The other side is the limbic system in the brain, and the limbic system is the fear and emotion center, and there are mast cells in that part of the brain. So if we want to reset our health, I tell my clients 50% of the healing process when we're chronically ill is rebooting the nervous system. This is so critical, and particularly those two areas. So the reason I call them out is because I've worked with a lot of people who say, well, gosh, you know, I meditate for half an hour every day. I do breathing exercises every day, but they're not targeted at those systems. And we have to address both of those systems. And those systems control chronic health, whether we can turn it off or we're going to stay stuck. And they're going to control communicating to those mast cells that they can start to calm down and let us move forward with healing. So there are very specific ways that we can work with those.
And what can you give some examples? Is it biofeedback? Is it certain supplements? I mean, I think that people need to get a sense.
Yeah, I'd love to. So biofeedback can be very helpful for people. And this is a process, for those who aren't aware of biofeedback, there's lots of ways that it's done. But the core of it is that you're monitoring some aspect of your body functioning, like your heartbeat, like your blood pressure, and then learning how to manage it and to relax into lowering your blood pressure, lowering your heart rate. Mm-hmm. Now, a lot of my clients, though, have issues like what are called POTS or dysautonomia, where there's so much dysregulation in the nervous system. Their blood pressure may be really low already. Their heart rate may be really low already. So that works for some people. It doesn't work for everybody. It's just like all of these. But
right.
Some of the things that we can do, let me start with the limbic system. The limbic system is very specific in how we work with that. There are two major programs that are available right now. One is called DNRS, Dynamic Neural Retraining System, that was developed by Annie Hopper. And the other is the Gupta program, developed by Ashok Gupta. They're both really good programs. And these programs, the key to them is to go from our chronic sympathetic fight or flight response that we're all in. I've met less than 5 people in my life that was not sympathetic dominant.
Oh, yeah.
You know, we're all just, our culture pushes us into that, you know, overwork and rushing everywhere and having kids in 10 different types of extracurricular activities. So it's shifting from that kind of state, and whatever we're worried about, reprogramming that to a place of deep calm and safety in the body. And to give people a sense of what that means, if you can imagine your absolute favorite place in nature. So mine is the ocean. And if it's the ocean, if it's the desert, the mountains, wherever it is, the weather's perfect. You're able to lie on the ground. There are no bugs. It's not too hot. It's not too cold. It's just right. And you can just let go. And everything falls off of you. And you feel really calm and peaceful, grounded in your body. That's the parasympathetic healing response. And we can't be in sympathetic fight or flight and parasympathetic rest and heal at the same time. They work like this. You get one up and one down. So if we want to heal, we've got to bring that parasympathetic state. We need to be in that a good 60 to 70% of the day. And that's a lot for most people, but we have to train that. It can take 6 months to a year to train that. And then we've got to maintain it. It's a practice. So there's also, for the limbic system, IV ketamine is very helpful. And low dose, not the really high doses they use in pain clinics, although that can be helpful for pain. IV ketamine will actually prune the extra synapses, the extra overactivity of the nervous system in that limbic system, that fear and emotion area. That's really good for trauma. It's used for PTSD. It's used for anxiety, a lot of applications, depression.
Right, and you have to find a person who's been trained to know how to do this. This is not standard training of your regular internist, and even functional medical doctors or naturopaths don't know how to do this. It's a very specific training people go through.
It is very specific, but there are centers in every major country across the United States now. It's really expanded. It's really accessible. But people are really
go about finding a center that does IV ketamine.
Yeah, you can Google IV ketamine and look for, you really are looking for more the centers that are dealing with depression, dealing with PTSD, dealing with anxiety, unless you have severe chronic pain. The reason I say that is if you're a little sensitive, it's going to be better to start lower dose, and they have more ability to start lower dose than the pain clinics. They go very high dose and they don't have a lot of room to change their protocols. But you can look into it. It's not right for everybody, but it's pretty good. It works quite well. And even my sensitive clients, if they start with around 10 milligrams, do quite well with it most of the time. That's the limbic system. Then we have the vagal nerve system, which I really like Stephen Porges named the polyvagal system, meaning multivagal, because there's all these branches. And we're talking about that and these other nerves at the top of the neck. They're also controlling and monitoring for safety. And can we come back and relax into that parasympathetic and start the healing process? So all this is a big missing piece in a lot of what is people are doing if they're only doing supplements and medications. Like, we need this branch to fully heal. And I can tell you just from my own journey of barely being able to walk, having to use a cane to walk, not being able to work, to being able to go back to graduate school and build this practice, I would never have been here with supplements and medications alone. Those were important, but this was important as well.
So how long did that process take you to get to the point from being totally disabled, not able to walk, in bed, to being able to think and function and think, oh, I'm now able to apply to graduate school? Was that 3 years, 5 years? Yeah.
That took me about 5 years, but I was a super sensitive person. So I was the person opening the capsules, doing a little sprinkle of my, supplement. But it took me about 5. So other people can do in a year or 2. Some people might take 5 or 6 like me.
So this is really good for me because as a practitioner, I treat people who I am sure have mast cell activation syndrome, and the diagnosis is difficult, and then knowing how to treat it's, as you just said, it's not just supplements. So how do you work with the polyvagal nervous system?
There are lots of ways, and you'll see things online like humming, singing, gargling, and those can help. But if the vagal system is really dysregulated, those aren't going to do it on their own. Then it's a matter of finding the right fit for the right person. And as many modalities as somebody can do, the faster this will reboot. And I'm going to give some specific things here in a second. But I do want to say a lot of people I work with are overachievers like me, and we want to just dive in there and do 130% and get it done. And that's not how this is going to work.
Right.
It's about shifting that nervous system gradually. And I tell my clients, shift it with a feather, not a sledgehammer. So you don't want to start with 10 new things in one day and go, now, vagal nerve, you get in line. It's not going to respond. That doesn't feel safe. Have to feel safe. So some of the things that work really well for people, there's a listening program I love called Brain Tap. And this is not like a meditation you're going to find on YouTube. This doesn't exist on YouTube. Brain Tap was developed by Patrick Porter, and it's based on the cutting edge vagal nerve research. There are different tones and frequencies in each ear. There are vagal branches in the ears. And you can start with just the audio program. And then if that works for you, you can build up to what they call a headset. It's got lights, red and blue lights in the ears, and has a little visor. My husband calls it my Jedi mind training kit because it looks a little spacey, but it works quite well. And if people are interested in learning more, we've got a whole blog on our website talks about it.
Thank you.
There are other vagal nerve releases you can do for yourself. And there's a great book called Accessing the Healing Power of the Vagal Nerve by Stanley Rosenberg. He was one of the top trainers in craniosacral therapy in Europe and developed these releases. And they're very gentle, very simple things. One of them is holding the back of your head and looking gently to the side for just about 30 seconds. And the nerves in the back of the neck are tied with the movement of the eyes. And then once you do that for 30 seconds, so you have to kind of rest your head into your hands, then you do the other side. And I do want to tell people, one of the things people do, again, is they overdo this and they look aggressively and they're straining their eyes. And that's, again, counter to what you're trying to do. So it can be very gentle. So he has this whole series. You don't have to read the book. You can go to the exercises in the back and work through them. Another thing that I love is called Safe and Sound Protocol. So that was developed by Stephen Porges, who did most of the cutting edge research on the polyvagal system. It's a different type of listening program. It's more in depth than the Brain Tap. So the Brain Tap is kind of an intro, nice maintenance. Safe and Sound is a program that you do with a practitioner with you, and it can be done remotely with a practitioner. And we have someone on our team who does that remotely. And this is a different type of listening program that resets the vagal nerve, but it's more intense. So that's why you need a practitioner to go through with you, and they'll pause you if you start to breathe too quickly or your shoulders are coming up, because you're resetting this system. So sometimes it's going to go, whoa, trying to figure out where to land and get a little unregulated to re-regulate, basically. That's a great program. These are some of the examples of what people can do. There's a modality called frequency-specific microcurrent.
Yes, I love microcurrent.
Yeah. And
I have a little mini one right here.
Yes. Yeah. And it helps reset the signaling of the nervous system. There are all kinds of vagal programs. And I have a whole course. I know it's a lot of information, a lot of things. I have a whole course that helps step people through these types of modalities and a whole roadmap to see which ones are right for you based on your nervous system dysregulation symptoms. How much do you need? How much time should you put in? And so on.
Well, Beth, this is fascinating. And what school did you, you went to a functional medicine program, or how do you learn about this specific area?
I didn't learn about this in school.
Wow.
I learned about this starting for my own survival. And I had seen over 75 practitioners.
Oh my
I
goodness.
stopped counting when at $350,000. I mean, I was desperate to heal. And I just failed everything. And the best practitioners said, gosh, I'm so sorry. You're the most complex person I've ever worked with. I don't know what to do. And many who were frightened by how ill I was said that I was crazy or I wanted to be sick because they didn't know, what was
That's
wrong.
very insulting. I'm sorry you had to go through that. I mean,
Yeah,
that's
I am too. But I tell you, it developed a lot of compassion and empathy for me for what other people deal with. But what happened was I, just like so many other people, was looking online, following whoever. I figured I had histamine intolerance, which is a problem with high histamine foods. And I
mhm.
was following Yasmina Kellenstam, who you may have known. And then she started reporting about mast cell activation syndrome. And I was like, this is it. This is what I am experiencing. This is why this is so bizarre
Mhm.
and nobody can figure it out. And this before the diagnostic criteria. So, this was years ago.
We're one of the beginning people.
So I read every paper that was out there. I followed every practitioner I could follow. I mean, I just consumed this and I was in all the groups and following what was working for people, putting this together. And this has been a work in progress for a decade to put together. How do we manage this? How do we work with it? And then I mentor really closely under Dr. Neil Nathan, and he's one of the world experts in mold toxicity, mast cell activation,
Yes,
Lyme, and sensitive people. So that's how this has come to be.
that's beautiful. And did you find that you had mold toxicity?
Yes. So that once I figured I had the mast cell activation syndrome, a lot of what was being written said that this was degenerative and it was progressive.
Yeah.
And whether it was denial or some kind of knowing or just eternal optimism, I wasn't willing to accept that. So I said, that's not going to happen for me. And the key is to figure out what is causing this, what is triggering it. Doesn't make sense to me that you can't turn this around. And so I did find out I had Lyme, Bartonella, and Babesia. I had known that before the mast cell
Oh,
activation, but I couldn't tolerate any treatments.
right.
Then I found out the mold toxicity. That and the nervous system work was the game changer. And this kind of targeted nervous system work. I had started studying yoga and meditation at 19. So I was a seasoned meditator, but I couldn't meditate my way out of the
No,
anxiety, the panic, the dark
no,
depressions, and that.
no.
But yes, the mold toxicity, that is another piece that is huge in what we do. It's at epidemic levels as well, and is even less recognized than mast cell activation syndrome. This is the biggest trigger of mast cell activation syndrome, hands down. And then ochratoxin, aflatoxin. I don't know why this isn't being dealt with, because there are piles and piles of research on these two mold toxins, ochratoxin and aflatoxin, and how carcinogenic they are,
Yeah, they
and
are.
contributors to cancers, breast cancers, all kinds of cancers. I mean, it's completely laid out, but
Yeah.
it's not being handled. It's not being talked about enough.
I don't know why. I guess it's not a cool illness, or there's no specific drug. Like you have this problem and then you take this drug and it goes away. I mean, basically
It's
what has to happen
complex.
is the person has to move, and anything that can't be washed, like their furniture. I've had women with this. They had to leave their sofa, their chairs, anything that couldn't be detoxed, washed, or cleaned needed to be thrown out. They needed
Well,
to move.
fortunately, we have ways now that about 95% of people can stay in their homes. Now, if the home is completely full of mold in the walls and underneath the floors, then
Yeah,
that's not going to be worth remediating.
no.
But about 95% of my clients are able to clean it up. They
How do you do
clean the
that?
possessions. Well, depends on where those sources, but the big picture is you have to remove the water source. Mold needs water or moisture. I'm going to say moisture. It needs moisture and it needs nutrient source. So if we've got a water leak, I just had the compressor line in my fridge. Is something's wrong with it, and just realized it's been dripping, and I can see that the floor has a little bubbling. So that tells me it's been dripping for a long time. That's a water source for mold. So we're going to have to fix that and get that part of the floor torn out and replaced.
That's an claim, and it's very contained. I had that problem too. I have the whole kitchen floor pulled up.
So we've got, and the other type, so we can have moisture issues from roof leaks, from leaks in the walls. You can have moisture issues from things like the fridge or the dishwasher leaking, or humidity. This is where it's often missed. And I work with people across the entire country. The only place I get people that sometimes don't have mold in their home is the desert. That's it. Because everywhere else is humid. And then the huge pockets are the areas where there've been the hurricanes. So the whole Gulf Coast region where Hurricane Sandy hit, that's a hotbed. And then along the West Coast, the California coast, the Pacific Northwest, we get a lot of people that are dealing with this just from the sheer humidity levels. And where I am, which is along the Ohio River Valley, it's very humid here as well. So we installed a whole house dehumidifier, or people can use the standalone units, keep that humidity managed. And then it can't have a food source. So food source is going to be things like drywall. Now, it doesn't mean you got to rip out all your drywall, but if you've got drywall, you got to keep it dry. It can't be wet. Right. It can't be damp. It can't be humid. But you get those things handled. Then, and that's where the mold inspector comes in. Now, unfortunately, there's not a lot of great mold inspectors who get this either. So people are spending money. Mold inspectors are coming in and telling them that's, you're fine, and they're not fine.
Right? Yeah.
Right. But, and then we use particular fogging agents. I really like a company called BioBalance. They have fogging types of agents, and not all foggers work. Ozone, do not use ozone, because that causes the mold to produce more toxins. And the ozone's really hard on people with health issues. But BioBalance is the one that I found that was really effective. And we've got before and after testing showing it. Does not replace the remediation. So you've got to get rid of that water source. And then if the materials are damaged, like this floor I was talking about, or drywall got wet, you've got water stains. You've got to cut that out. It's got to be cut out at least 2 feet from the visible damage, because mold makes these little tendrils like roots, and then it'll regrow. And then people need to do a deep clean. They need to really clean. That company I mentioned, BioBalance, has wipes that are really nice. There's other things people can use, but you got to clean, get rid of all those mold spores, wipe it all down, wipe down anything that's hard-sided. Then at that point, it depends on the extent of the mold exposure. So if it was small and isolated, like my fridge issue, we had an issue in the unfinished area of the basement that we had to really spray down. We had to handle and water seal, but we didn't have to throw everything out, fortunately. If somebody has a huge amount of mold in the house, if you can get it managed, you may be able to just wipe the hard things down. And then I have them go through a process where we'll start, if they're still reacting and they're not getting better, I'll step them through a process of, okay, let's start with the mattress. Let's replace the mattress. Things that are porous, things that the mold toxins can absorb.
Sofas are a big one for me.
Sofa,
gotta get rid of the sofa. Just don't even try.
Sometimes you gotta replace the carpet, things like that. But I step people through a process, because there's so much out there around the mold avoidance, and you just have to get out and leave everything behind. And it's so traumatic. And then that makes people more ill. It's like having a fire and having lost everything. So how do we do this in a way that is still taking care of us? That's what I think of.
I agree 100%. That's beautiful. Well, Beth, thank you so much for your expertise. And there is a lot of consistency between what you went through and what women with breast cancer go through. And it's really nice to know about you, for me, myself, professionally, in my community. And thank you for what you do. And I think you're an example to everyone because you were so ill and you had seen over 75 practitioners and had some pretty horrible things said to you, but you held on to your inner connection to believe that, no, I'm not crazy. And there's something going on here that isn't, people can't figure out what it is. And you just proceeded to be consistent and determined to heal yourself, which is really what life sometimes is all about. We have to find the right person. Starts with ourselves, right?
That's exactly it. And it's not that it was easy, Carol, or I didn't have meltdowns, and I did 10 years of therapy to make
Yes.
sure that it wasn't psychological, you know.
Yes. Yes.
But if I'm nothing else, I'm tenacious. And the thing is, what I kept coming back to is, well, what else am I going to do? I can't eat bonbons because they make me sick. So I can't sit on the couch and eat bonbons and just watch TV all day. You know, what am I going to do? And that's what it just kept coming back to is
tenacity is a good word.
Have a meltdown and then get back up the next morning and go, okay, what can I do today?
Get back up the next moment, have your meltdown. That's fine. And now that's over with. I'm on to the next moment.
Yeah. So if I can use that nightmare to help people get through this faster, then it gives some meaning and some worth to what I had to go through.
Oh, yeah, totally. Really. Well, thank you so much, Beth. It's really been an honor to have you here. And I love knowing about you because you're now my go-to person who I can refer people to who have multi-system problems who aren't getting better with what I'm doing. And that's very important for me, that the people I work with get better. And if they're not, I'm going to refer them to you.
Well, I just want to thank you as well.
Mm-hmm.
I just want to thank you as well for what you do. There's not a lot in terms of holistic care for breast cancer, and it's so critical. To change that. Yeah, I know.
You are in your area.
Really team up and connect.
Yeah, thank you. Well, thank you very much, Beth, and thank you everyone for all of you who watched now and all of you who will watch later as part of my bonus from my Empowered Against Recurrence program. And this is Carol Laurie signing off for now, and there'll be more later. Beth, just hang out for 2 seconds. And thank you, ladies, and there'll be more later. Have a lovely day. Bye for now.